they usually think that this is something like a car factory or something like a coal mine. But science is not like that. Science is continuously evolving, and human health, which is including several 100,000 environmental agents and also tens of thousands of genes and tens of thousands of proteins. So it is very complex, and it is very open for future research, and we can never say that we came to the end and we finalized this. So the most important thing for the policymakers is to support research in the best way.
It's a total rethinking in how do you evaluate what step in the management. I think what we have to do first is to do quite some research, to do quite some clinically related research, but using endotypes, because we don't have the studies yet to show what exactly is needed in what type of endotype. But the more you come into this area of precision medicine, the more you can differentiate in the patients with severe disease and the less severe disease. And the more you can early prevent or interfere and prevent the development of this disease, for example, into a comorbid asthma or severe asthma. And that is the chance that I see for the future.
Well, first of all, they need not to be scared, because the problem of precision medicine is cost. If in each patient you are spending 1,000 euros for diagnosis in rhinitis, then the World Bank is bankrupt. So we need to make these people know that there are most patients who can have OTC treatment, large number cheap treatment, and a few people with very expensive treatment. So we need to convince them that patient stratification is vital.
Public authorities actually need to support initiatives in precision medicine, because they should realize that precision medicine is the way forward in the future, because it will be associated with prevention of disease, with patient satisfaction, and with a huge reduction of socio-economic costs.
Healthcare policymakers always look at the short-term view. They're looking at the cost of my treatment today compared to the alternatives. But these diseases that we're talking about have a lifelong history. And so we need to think about the cumulative costs over a lifetime of the patient, both in terms of the costs and side effects of a relatively cheap treatment compared to potentially a higher initial cost of a more expensive treatment, but perhaps lower long-term costs. So we need healthcare policymakers to look at the long-term bigger picture, which they don't always do.